Hello, and welcome to the first webinar in our May is Speech and Hearing Month webinar series. My name is Lisa Archibald, and I'm the director of the School of Communication Sciences and Disorders. And today I'm pleased to have my colleague, Dr. Jack Scott, as our first presenter in this series. Dr. Scott is an audiologist and associate professor in our school with interests in a number of hearing-related issues and outreach issues as well. And he's a clinical instructor in our H.A. Leeper Speech and Hearing Clinic. And Jack will be presenting today on sound safe practices. If you have questions for Jack, please put them in the chat and we'll have time to take them up at the end of the session. Jack, please go ahead.
Thank you, Lisa, and thanks everybody for allowing me to be here today. I'm going to go ahead and sort of get my PowerPoint slides set up just to make sure that everything's working appropriately, and then I'll share my screen. Let's go ahead and try to share my screen now, and then we shall see if I can get this working. Right. And we're okay to see that, Lisa?
Yes, I can see that fine, Jack.
Perfect, thank you. So yeah, thanks for coming. So this presentation is going to be about hearing loss, the impacts of noise on hearing, and also talking about different types of noise protection out there that is available on the market, whether it's available online or at your local audiology clinic or the H.A. Leeper Speech and Hearing Clinic. So as Lisa said, my name is Jack Scott. I am an assistant professor in audiology, clinical supervisor in audiology, so supervising students at our in-house clinic, supervising graduate students with regard to hearing testing and fitting of hearing aids and noise protection. The aspect of noise protection is something very near and dear to me. Obviously, as an audiologist, the importance of protecting your hearing is something that's vital. And it's not really something that I thought about until I was well into my graduate school. So when I was in my middle school and high school years, I was a snare drummer. And at that point, if it was too loud, you were too old. And so we kind of relished in the fact that if we struck our snare drum really hard, it made other people cringe. I never really thought about the impact that might have on my own hearing until I got into graduate school. That being said, I would be remiss if I didn't mention that I spent countless hours at clubs during my undergrad and grad school, again, not really thinking about the impacts of noise on my hearing system. But before we talk about the impact of noise on the hearing system, let's talk about the hearing system first. Like, how do we hear? And so what I brought up first in the slide is basically a schematic of the hearing system, or the ear that we think about it. Now, this is not all-inclusive. Obviously, the sounds and signals have to travel up to the brain. But from an audiological procedure or audiological aspect, we think about the ear with regard to this part. We have three sections to the ear: the outer ear, which encompasses the part of the ear that everybody sees, the ear canal, and then the eardrum. The middle ear, which is an air-filled space that has little tiny bones that connect the eardrum to the inner ear, and more specifically, the hearing organ, otherwise known as the cochlea. And so when sound is picked up by the ear, that sound travels down the ear canal, strikes the eardrum, moves these little bones in the middle ear space, and then causes a wave inside the cochlea. And inside the cochlea, we have tiny hair cells. And these hair cells are not like the hair cells on the top of your head. These are hair cells that actually, when the little fibers on top of the hair cells move, actually cause an electrical impulse that then sends the signal to the brain. And so when this wave comes in, this membrane right here actually moves. These fibers are connected to or very close to a membrane on top of it. And when this wave comes in and moves the membrane at the bottom, the fibers hit the membrane on the top, and it causes those fibers to bend. And when those fibers bend, it then causes an action potential that sends the signal all the way up to the brain, that then we perceive the signal as sound. The auditory system is actually laid out what's called tonotopically. And what I mean by that is different areas of the cochlea, and this is a representation of the cochlea, again, that spiral-shaped portion to the inner ear. The cochlea is laid out tonotopically in that certain parts of the cochlea are more sensitive to some frequencies and other frequencies. And so here we have sort of a graphical or color representation of the sensitivity of the cochlea to the different frequencies. There's a part of the cochlea that's very sensitive to very low pitch sounds, in this case 500 hertz, which is very low pitch sound. And then as the cochlea unwinds, the cochlea becomes more sensitive to higher pitch sounds. And so depending on where you are on the cochlea, parts of the cochlea are more sensitive to some frequencies versus other. And this tonotopic organization, interestingly enough, is seen all the way through the auditory system, even up to the auditory cortex within the brain. And so if a low pitch sound comes into the ear and activates the low pitch part of the cochlea, then that signal travels through the auditory system to the auditory cortex part of the brain and actually stimulates the low pitch neurons in the brain that are more sensitive to those frequencies. And it's laid out, again, very similar to the cochlear, where we have this tonotopic representation. Another way to think about this is like a piano. So just as a piano, you have some keys that respond well to the low frequency sounds because of either the shape or the weight of the chord. And then as you go across, some keys actually produce a higher pitch chord or a higher pitch sound because of how small or how tight those chords are represented. And so we see this tonotopic organization throughout the auditory cortex. And as I mentioned within the cochlea, again, that spiral-shaped part of the inner ear, we have hair cells. And again, on top of the hair cells are all these little fibers, sometimes called stereocilia. And this is actually a very specific look at those fibers. And we can sort of see the hair cells. In this case, we have the outer hair cells and the inner hair cells. And then we see the fibers that kind of jut out from those hair cells. Now, these fibers are very important for hearing because, as I mentioned, if this membrane moves and the fibers then touch the membrane on top of it, what should happen is those fibers should bend. And if the fibers bend, then it causes that action potential that sends the signal to the brain, and then we hear the sound. But if a wave comes in that's really high, like that could be caused by a very loud sound, it can cause this membrane to move very dramatically and force the little fibers up against the top membrane and actually cause those fibers to break. And if those fibers break, again, what that can do is then not allow them to bend. And if they're not allowed to bend, then we're not getting that action potential to fire, and that actually is where the hearing loss occurs. So in that case, if the fibers are broken, if the fibers are missing, if they're broken in half, then you need a larger sound or a louder sound to come in to cause a bigger wave to be able to have those fibers touch the membrane that are on top of them, to be able to have the bend that occurs that needs to then cause the action potential to send the signal to the brain. And so these fibers, when they break, they are not repairable. They do not rejuvenate. So similar to the hair on the top of your head, if you have hair loss, that hair loss does not come back. Very similarly, inside of the cochlea, if these fibers break or are damaged, then those fibers will not come back, and then you have permanent hearing loss because of those fibers being gone. Interestingly enough, just to kind of point this out, in birds, these fibers actually can grow back. So within birds, if those fibers are damaged due to loud sounds or due to any sort of infarct that occurs, those fibers will actually grow back. And there's some research that's been going on for decades right now to see why do the fibers in birds grow back and why do they not grow back in humans? And is there something that we can do to be able to then cause the fibers in the human system to be able to grow back thus hopefully reversing hearing loss. But we're not quite there yet, unfortunately. As I mentioned, if a loud sound comes in and causes a large wave that then causes those fibers to dramatically hit that membrane that's laying on top of them, they can break and they can get damaged or they can get completely destroyed. Now, when we think about noise exposure, exposure to loud sounds in the environment, many people think about typical loud sounds like an air blower, a leaf blower, a lawn mower. We're starting to realize the implications of headphones being worn at very high levels and how that can then produce loud sounds into the ear. And then one of the things that we're kind of looking at here at the HE Leaper Speech and Hearing Clinic or considering is what is the impact for even musicians who play in orchestras or in bands that are around very loud sounds that then can cause potentially hearing loss. And so what I mean by that is that the loud sound that causes hearing loss doesn't have to be noise, and noise is considered unwanted sound, but even sounds that we want to hear, such as music, can be loud enough to potentially cause hearing problems or hearing loss in an individual. But how do we measure sound, and how do we know if a sound is too loud? The graph that I have here to the left on this screen represents basically the range of human audibility. Along this axis, we have pitch, so very low pitch sounds to the very far left, to very high pitch sounds to the very far right. And so the human auditory system can hear between what's called 20 hertz, which is a very, very low pitch sound, and 20,000 hertz, which is a very, very, very high pitch sound. The blue area here represents kind of our range of audibility for normal hearing individuals. The line represented at the bottom here represents our threshold of hearing, or how loud does a sound have to be for us to just barely be able to make it out. Along this axis, we have the loudness of the sound, so very soft sounds at the bottom, very loud sounds at the top. What we can sort of see with this, and I'll sort of walk through it a little bit, is that for very low pitch sounds, like 20 hertz, we need a sound to be relatively loud in order for us to just barely be able to hear it. As we go up in frequency or pitch, that sound can be much softer before we actually hear it. And then when we move up to the very, very high pitch sounds, those sounds again have to be a lot louder for us to barely be able to hear them. Interestingly enough, the frequencies or pitches that we are most sensitive to actually are in the range of speech. And so our auditory system, either because of the chicken before the egg or the egg before the chicken, our hearing system is most sensitive to frequencies or pitches that fall on or around human speech. Here we have a representation of where speech tends to fall between 100 hertz to about 5,000 hertz at around this intensity. And then for music, typically it can range from a lower pitch to a higher pitch, and music that you may listen to on average tends to fall between about 40 decibels loudness on up to about 100 decibels loudness. Now, this very top line here, the threshold of feeling, this is where sounds are so loud that our hearing system can actually feel the sound, not just hear the sound, but it's actually causing physical pain because of the intensity of the sound coming into the ear. When we think about how we measure sound, we have different rating scales that we talk about when we measure it. We measure sound in decibels, otherwise known as dB, and this is that sound pressure of loudness. The dB rating that we tend to use when we talk about the level of sounds in the environment is something called dBA. So decibel using an A weighting. And what does an A weighting mean? An A weighting just basically means that the microphone of the system that we're using to measure the sound actually has a sensitivity similar to the ear. And what do I mean by that? I mean that that microphone is most sensitive to sort of the mid frequencies or the mid pitches, less sensitive to the very, very low pitches, and less sensitive to the very, very high pitch. So in essence, that microphone is almost mimicking the sensitivity of the human ear. Now, again, sounds at very loud sound, very high levels can actually cause hearing impairment. And a good rule of thumb that we like to talk about is if you're in a loud environment and you're about 3 feet away from somebody, if you need to shout for that person to be able to hear you, that environment is too loud to be in. So the sound is too loud, and there's definitely a chance that that sound may cause hearing impairment. But what is too much sound? So a couple of things to think about with this is that damage from sound exposure not only depends on how loud the sound is coming into the ear, but also how long you're in that environment. So not just how loud it is, but also the length of exposure for that situation. Through scientific studies and research, what we found is that on average, if the sounds exceeds 85 decibels, or is 85 decibels or louder, you can be in that environment for less than 8 hours before hearing impairment occurs. Or to put it another way, to be able to be in that environment for at least 8 hours, let's say like you're in a working environment, the level of noise in that environment needs to be 85 decibels or less. So if it's above 85 decibels, you should not be in that environment for longer than 8 hours. And of course, this is important when we think about the impact of noise exposure or occupational noise exposure on individuals that work in very loud environments. So interestingly enough, our ears may recover from short exposure to loud sounds, but if you're in that loud environment for a long duration of time, then that damage may actually become permanent. This may have happened to you before, where you've actually gone to a loud club, let's say, or listened to a band, and when you've left that environment, you may hear sort of a muffled sound, and sometimes you may hear ringing in the ears, which is called tinnitus or tinnitus, depending on how you like to pronounce it. Typically, that muffled sound will recover in a couple of days, and the muffled sound actually implies that you've caused temporary hearing loss to your auditory system. Now, ideally, that temporary hearing loss should recover. And again, in a couple of days, your hearing should come back. But if you're continually exposed to loud sounds over multiple times, again, loud sounds for shorter durations, then that increases your chance for making that temporary hearing loss actually become a permanent hearing loss. But risk of damage depends on a variety of things. So as I mentioned, risk of damage can depend on how loud the sound is. Again, if you're in a very, very loud sound, you need to be in that environment for a less amount of time than if you're in an environment that has a lower level of sound. You can be in that environment for a longer duration of time. So how loud it is plays a factor. How long you're exposed to that sound plays a factor. How much rest your ears get between those exposures. So as I mentioned before, if you allow your ears to rest for a couple of days, then ideally that temporary shift in hearing will recover. But if you go back out to hear a band the next night, or back to a club the next night, or you use a loud piece of equipment the next day, and you don't allow your ears to naturally recover, then that continual damage that you're applying to the auditory system may result in, again, permanent hearing loss. And then there's some individual susceptibility that comes into factor here. There's genetic predisposition to hearing loss. So over time, all of us will experience hearing loss just due to the natural aging process. But some individuals are more susceptible to the impacts of noise exposure than other individuals, either due to genetic predisposition, due to environmental contaminants that they may be in. There are some medications that if you're on, it may actually make you more susceptible to the impact of noise exposure. If you have medical conditions that may impact blood flow or circulation, such as diabetes or heart disease, then that may make you more susceptible to noise exposure and the impact of noise exposure on the auditory system. And then also some behaviors may impact this as well, such as smoking, which, as we know, also impacts the cardiovascular system. But how much sound for how long can you be in? And there's two organizations. The first organization I'm going to talk about is the Occupational Safety and Health Administration in the USA. Their permissible exposure limit, they say that you can be in a 90 dBA of sound for 8 hours before you may be susceptible to noise exposure. With regard to the Canadian Centre for Occupational Health and Safety, their noise exposure level for the federal side says that you can be in 87 dBA of sound for 8 hours before you increase your chance for noise exposure. And then the provincial, and this varies from province to province, but I'm sort of focusing on Ontario specifically, says that you can be in 85 dBA of sound for 8 hours before you increase your chance for noise exposure. And there's a 5 dB trade-off for the OSHA, or Occupational Safety and Health Administration, and a 3 dB trade-off for the federal and provincial. And what do I mean by trade-off? What I mean by trade-off basically is that for every 3 dB, and we'll focus on provincial specifically in the Ontario one, for every 3 dB increase of sound, you have to half the time or have the time of exposure to that environment. So when you're in an 85 dBA environment, so when the sound around you is 85 decibels, you can be in that environment for 8 hours theoretically. Again, there may be some genetic susceptibility to this, but theoretically, you can be in that environment for 8 hours before you increase your chance for noise exposure or noise-induced hearing loss. If I take that sound and I move it to 88 dB of noise, or 88 dBA, then I have to half the time that I can be in that environment. So no longer can I be in that environment for 8 hours, but now I need to be in that environment for 4 hours. If I take that from 88, so from 85 to 88, if I take it from 88 to 91, now I have to half that divide that by 2, so that no longer can I be in that environment for 4 hours, but now I need to be in that environment for 2 hours. And so with many of this, again, it assumes an 8-hour workday, 5 days per week, over a 40-year career. And one of the things that we'll look at in a little bit is a study where they actually took measurements of noise exposure for individuals and came up with sort of this daily sound exposure value to determine how much time can you be in that environment before you increase your chance for noise exposure. As I mentioned, with the exposure limit provincially or within Ontario, again, we had that 85 dBA, again, minimally or maximally, I should say, 8-hour exposure limit. If we take it to 88, now it becomes 4 hours. 91 now becomes 2 hours. 94 now becomes 1 hour. 97, 30 minutes, and so on and so forth. And so for every 3 dB increase in intensity of the volume, again, you need to half the amount of time that you're in that environment. As you can see, for 106 dBA of noise, if you're in that environment, then you can only be in that environment for about 3 minutes and 3 3/4 minutes before you increase your chance for noise exposure. But how loud are certain sounds in the environment? So this is kind of a representation of some sound in the environment, just to kind of give you an idea of how loud sound or how loud things may be in the environment. A whisper falls at around 30 decibels. A lawnmower falls at around 88 decibels. So again, using sort of that provincial aspect where 85 dB means that we can be in that environment for 8 hours. If a lawnmower is around 88 decibels, then hearing damage may occur if you're in the environment for longer than 4 hours. A hair dryer is around 91 decibels. And so ideally you could only be around hair dryers for about 2 hours before you increase your chance for noise exposure. And then as you go up in intensity, as we can sort of see, the chance for hearing loss increases. Interestingly, for a motorcycle, and obviously this varies from motorcycle to motorcycle, if your motorcycle measures 97 decibels, then theoretically you shouldn't be on that motorcycle for longer than 30 minutes before you increase your chance for noise exposure. Or if you're on a snowmobile and that snowmobile is 100 decibels, you should not be on that snowmobile for longer than 15 minutes. And then we think about a leaf blower, and again, being measured potentially at 115 decibels, then you should not be using that leaf blower for longer than 30 seconds. If we think about some common carpentry tool and sort of think about how loud those things may be, and kind of gives you a representation of how long you can be around those different types of tools. I kind of took here sort of a line to indicate where you may potentially be around something for 2 hours or less. If you go past this line, and you're in there for a longer duration, then again, you increase your chance for noise exposure. And even looking at a hammer drill, which falls now at the very sort of the highest level at around 114 dB. If you're using a hammer drill for longer than 3.5 minutes, then there's a chance that you can increase your susceptibility, to noise exposure. But then some people say, well, loud sounds, I'm not around those types of things, but I may be around some music. So loud sounds don't just have to come from carpentry tools. They can also potentially play a factor when you're thinking about music. And interestingly enough, one of the things that we looked at recently at the HLE for Speech and Hearing Clinic and did a presentation for some students at our music school is the impact of exposure to loud music and how that may increase the chance of noise exposure for the students. And so I pulled together some data as I was sort of evaluating that and found this interesting study that came out of Poland, where they actually had music students, 7 music students specifically, wearing ear level dosimeters. And basically these are just devices that have microphones that measure the sound at the ear for the student. And these students kind of went through their day practicing or being in larger orchestral arrangements. And what they did was they measured the intensity level for these different music students. So one played a flute, one played a French horn, one played a trombone, so forth and so on. And this is kind of a graphical representation for 2 students. This is a trumpet playing student, and this is a trombone playing student. This is time along this axis, and then this is loudness of the sound or the environment that they're in during that time. A green square represents a solo, like the students playing by themselves. They're just practicing their own solo arrangement. Red indicates that they're practicing in a symphony orchestra. Blue may indicate that they're in a wind orchestra, and then purple may indicate that they're in sort of a big band, or violet, I should say, indicates that they're in a big band. So they had these students wear these devices, go throughout their day. Obviously, there's some breaks in those days while they're probably having lunch or potentially dinner, while they're resting before the next performance. In this case, the trombone player, this individual didn't get a lot of breaks during the day, went quickly from a solo to the chamber ensemble to a wind orchestra, probably had dinner around this time, around 5 p.m., and then went into their big band. And so again, they've sort of followed these different musicians over these 8-hour days and took all the information, let's say for the flute player, for example, averaged that information together and said, okay, let's say that this person's in this environment consistently, constantly over this period. How loud is that? Well, how loud would that environment be? So for the flute player, and we're looking at this very far right box here, for the flute player, given the variability of the intensity of the instrument that they're playing, what they found was through their day, when they did the measurement, it's as if the flute player is in 101 dB of noise over an 8-hour period. For the double bass player, what it found was that for that individual, it's as if they were in an 8-hour day or an 8-hour day in constant noise of 76.4 dB. And if we think about the flute player specifically, again, given that it's the highest one, and during this study, again, being exposed to the loudest sounds, what they found was that their levels often exceeded 100 decibels. And again, for an 8-hour day, what they measured is that it would be as if they're in 101 dB of noise for the 8-hour duration. And if we think about that exchange rate, where every time you increase the intensity by 3 dB, you have to half the amount of time. For this flute player, the safe working time at the level that they're in, they should only be in that environment for less than 15 minutes. And as we sort of saw, they were in this environment for longer than that. And so the chance or the potential option or the potential for susceptibility to noise exposure is increased. As I mentioned before, if you are around noise and if noise does impact your hearing, what it may do is it may cause damage to these fibers that are part of the hair cells. And again, if those fibers are broken or missing, so this is an intact cochlea, we can see all the rows of fibers that we have from our hair cells. And this is an example of a damaged cochlea where now the fibers are broken, the fibers are missing. If you have these missing or broken fibers, it can actually result in a reduction in the hearing sensitivity or a hearing loss. And the fibers don't have to break. They can bend and they can just stay bent, but they could be broken, they could be bent, they can be completely missing from this noise exposure. So how do we know if someone has a hearing loss? Well, many people will sort of self-report. They'll say, I have more difficulty hearing in certain situations. I have more difficulty hearing my spouse, or I find that I'm now having to turn up the television much louder than what I typically had to be able to make out the television shows. The other way that we can tell if someone has a hearing loss is we actually test their hearing. So just as determine if you have a vision difficulty, the optometrist will test your eyesight. If you have hearing difficulty, the audiologist will then test your hearing to determine how much hearing difficulty you may have. Before we test someone's hearing, the first thing that we tend to look at is we take a look inside their ear just to make sure that the outer ear, the part of the ear that we see, the ear canal, the eardrum is relatively healthy. And so we're looking for any sort of skin condition. The other thing that we want to try to determine is if this individual reports hearing loss, is it because the hearing loss is permanent because there's damage to these hair fibers or damage to the cochlea, or is the hearing loss temporary because there may just be wax in the ear, there may be debris in the ear, or there may be a possible infection in the ear. So we want to take a look inside the ear just to make sure that there's nothing that's impeding or impacting the sound traveling from the ear down into the cochlea, which then picks up the sound and sends the signal to the brain. And if you've ever had your hearing tested before, basically what we do is we have you wear headphones or have you wear devices that go inside your ear. We present a series of tones to each ear at different loudnesses. And what we want to do is find the softest that you can hear the sounds at different pitches and then compare your results to normal hearing individual. And so we have this normalized data to know what is quote unquote normal because many, many years ago, they evaluated hundreds, if not thousands of individuals to then say what is considered normal hearing. We take those responses and we graph them on something called an audiogram. And this is a representation of an audiogram that I'm going to kind of walk through a little bit just because I'm going to show you some different representation of hearing or hearing losses on this graph. Again, the audiogram is a graph of how we represent someone's hearing sensitivity. We tend to test very low pitch sounds and high pitch sounds. And so interestingly, as we go across this from low pitch to high pitch, as I mentioned before, we can hear from 20 hertz all the way up to 20,000 hertz. But when we test your hearing, typically we test between 125 or 250 hertz up to 8,000 hertz. And again, these are the frequencies or the pitches that the human auditory system is most sensitive to, because these are where the speech sounds tend to fall. And so we want to understand kind of the impact of your hearing on your ability to understand speech. On this graph, at the very top, we have softer sounds, and then at the very bottom, we have louder sounds. And so as you go from top to bottom, the sounds will get louder. And as we look at some of these images or graphical representations, we can see that at the top, we have images that are represented as very soft. So birds singing, leaves rustling. But then as you go down the graph, we get into conversation, we get into a vacuum, and at the very bottom, we can see an example of a jackhammer, a shotgun, a jet plane, or a band. And again, indicating that as you go down, the sounds get louder. This shaded area represents what we call the speech banana. So speech tends to fall sort of in this range. Again, if someone's speaking more softly or more loudly, it may range a little bit. Or if someone has a very high pitched voice versus a low pitched voice, this speech banana may move a little bit on the audiogram. But what it does show you is some of the representations of where certain speech sounds may fall. So the F, the S, the TH sound falls in the higher pitches, and then the mid pitches and the low pitches, the consonant sounds tend to fall in the mid and the high pitches, and then vowel sounds tend to fall in the low pitches. If someone had normal hearing, their responses, we would plot them on the audiogram kind of on or around this section. Here, the circles represent the right ear and the X's represent the left ear. And so for the right ear, this individual's thresholds fall at 25 decibels across the frequencies. And for the left ear, the X's, this individual's thresholds fall around 25 or normal hearing. Now, normal hearing is a range. And so not everybody falls at 25. Some people can actually have better than normal hearing. And again, normal just represents average. So some individuals can have really, really good hearing. But once you fall out of this normal range, you're considered to have a hearing loss. And this is another representation of basically an audiogram, just kind of showing you that you don't have to be at this 25 dB mark, but you can actually have better hearing than that. Again, the circles are the right ear and the X's are the left ear. But you can actually hear differently at different pitches. And so for this individual, in the lower pitches, their hearing is actually in the normal range. But then as you go up in pitch, their hearing gets worse. So you need sounds to be louder for them to just barely be able to hear them in the higher pitches. And this is something that we call a high frequency hearing loss. And typically when you have noise exposure, it tends to impact the higher frequencies first before it impacts the lower frequencies. And this is another representation of someone that has high frequency hearing loss, probably secondary to noise exposure, where they have normal hearing in the low pitches and a hearing loss in the high pitches. So these circles and X's, again, fall out of this range of normal hearing. And now sounds need to be louder for someone to just be able to make them out. But what does that mean for interacting or listening in a day-to-day situation? Well, if I take the area that's above the circles and X's and then I darken it, what this represents is anything above or softer is higher in this case, anything above the circles or the X, this individual cannot hear that. So they cannot hear these sounds. They cannot hear the leaves rustling. They cannot hear the birds singing because the birds now are too soft for their hearing system to be able to hear it. They're also not able to hear some speech sounds like the F, the S, the TH sounds. They're not able to hear these sounds. And some of these sounds, the consonant sounds, are important for speech understanding. And this is a representation of what can happen from years of noise exposure. So the blue line here represents a 25-year-old carpenter. So somebody who just basically started in carpentry, has normal hearing. The dotted line here represents someone who's 50 years old who doesn't have noise exposure. And so their hearing may be a little bit lower because it's still be, because of age-related hearing loss, but yet if this individual has been around noise for decades, potentially, what we can see is that this 50-year-old individual with no noise exposure has better hearing because it's higher up versus this individual that has more noise exposure, which is lower down on the graph. And then hearing loss from noise exposure or sound exposure is typically gradual. So is typically gradual, I say, but it can actually happen like that, depending on the situation. We tend to lose the high pitch first. Again, these are more important for speech understanding because we tend to lose the ability to hear these consonant sounds. And also, if you have a hearing loss, you may or may not also experience tinnitus or this high-pitched ringing noise that some people complain about. But how do we protect our hearing? And so let's focus on sort of the protection aspect a little bit and how to sort of wear noise protection. Before we talk about how to protect your hearing, I'm going to talk about how not to protect your hearing. And what you should not do is use cotton in your ears to protect your hearing. So cotton in the ears does not provide any sort of noise protection. This is something that even when I was younger, people would recommend for noise protection. But cotton does not provide enough attenuation to be able to protect your hearing. So you want to use something that's approved like earplugs, earmuffs, or musicians' earplugs. And so we're going to walk through some different types of hearing protection just to kind of make you familiar with kind of what's available out there on the market. But before we do that, we're going to talk about something that you may see on some of the packaging for hearing protection, and that is a NRR or noise reduction rating. And basically, the NRR or noise reduction rating is the amount of attenuation on average that hearing protection device or HPD will provide across 10 people in a laboratory environment. So they're able to measure how much attenuation or how much reduction in sound occurs when you wear that noise protection device for across 10 people in a laboratory test. But if you're wearing the device incorrectly, if you take the device on or off, depending on what you're needing to do or needing to listen to, it may impact how much noise reduction is actually occurring. And so that's why we talk about that's why we also recommend getting a hearing evaluation annually to sort of monitor your hearing. As you look at different
Jack, I'll
noise,
just let you know that you have a number of questions, so just to allow for that. But I know this is an important part, so I'll let you finish up with that.
Thank you. So just to kind of remind you, when you look at noise protection or noise reduction rating, we're not needing to block out the sound completely. What we're needing to do is reduce the level of the sound such that we can increase the amount of time that we're in that environment, right? So we're not needing to make it where it's completely quiet, but if we can take someone from a 94 dB environment, and we can reduce the noise that reaches their ear by, let's say, 11 decibels, then now that person can be in that environment for longer than 8 hours before the chance of noise exposure. In Canada, we also have a classification system for noise protection. It's as we say, the ABCs of hearing protection: A, AL classification, B, BL, and C. The L indicates a higher reduction in lower frequencies. And so if you're in an environment that's less than 90 decibels, the recommended class is a C. So when you go to look for buying noise protection, if you know what level you're going to be in, you can actually, if you know you're in an environment that's less than 90 decibels, you'll want to pick a C device. But if you're in a much louder environment, then you want to either pick the B or the A device, or if it's extremely loud, in some cases, you can actually wear 2 devices together. Again, this is based on laboratory measurements. So as I tend to suggest, getting your hearing tested annually and also erring on the side of something more powerful. So even if you're in an environment that's less than 90 dB, you can still theoretically use a B or an A class device to be able to provide you with the noise protection. So the types of noise protection that you may see on the market, the first one is a hand-formed earplug. This is kind of the soft earplug that you kind of squeeze and place into your ear canal. These have pretty good noise reduction ratings, or 29 plus. They are one-time use. And so theoretically, once you use it the one time, you should then discard it. Almost universal fit in that, it can fit a variety of ears because it expands to fit the ear canal for the individual. Inexpensive if in frequent use, but obviously if you're having to use a new one every day, it can get quite expensive and relatively comfortable. Kind of the con to these is they can be easily soiled. Again, it's a one-time use, and so after it's expanded, if you compress it again and expand it again by reinserting it multiple times, you may affect the amount of noise protection that you're getting. And proper insertion is also recommended. There are some pre-formed devices out there that have lower noise reduction rating. These can be washed and reused. Also less expensive versus other types of devices because they can be washed and reused, and they're fairly comfortable. One size does not always fit all, and so these do come in a variety of sizes. Depending on the ear, they may be more bothersome for some individuals. And with these, what can also happen is as you talk and chew, these can actually work their way out of the ear, which may impact the amount of attenuation that's occurring. And again, if you put these in incorrectly, it may impact the proper fit for the device. Custom earplugs, these are actually made specifically for your ears. And so an audiologist will make impressions of your ears, have these sent off to be able to be made. These are more expensive, because we have to make impressions of your ears. Because they are made specifically to your ear, they're typically more comfortable than other types of devices. Preformed devices also come in a music form in that there's a filter inside of them to make all the sounds attenuated across all the frequencies by the same amount. So it provides you with protection that maintains the quality of the signal. Still has very similar pros and cons to the preformed devices. And then there's also custom musicians earplugs as well that can come in a variety of different strengths. Again, the idea is that the amount of attenuation is the same across all the frequencies or pitches. And so the overall quality of the sound is maintained, but yet you're provided with the benefit of the noise protection. And there are earmuffs that actually go over the ears. These have very good protection rating. The benefit of these is that you can actually use these with additional noise protection. So you could have earplugs in your ears and then have noise muffs on top of your ears, which gives you that added protection from noise protection. And so you can adjust these in some cases. They can be cost effective over time because you can wear them and reuse them. Again, more expensive than traditional earplugs. Depending on what you're doing, they can be more bulky and heavy. And depending on the environment, because it is covering your ear, it may be uncomfortable in heat and humidity. And if you have glasses, the muffs tend to fit over the ear. And so if you have glasses, the earpiece of the glasses actually push the muff out a little bit, which reduces the amount of attenuation. And then finally, ear caps. These actually go inside the ear and they're held in place by the ear or into the ear by the tension of kind of this blue part. Now that can break down over time. It can become less rigid. And so the amount of pressure that's being applied into the ear can reduce, which then potentially can reduce the amount of attenuation or protection. But then how do you use this? Insertion is the most important part, or wearing these correctly is the most important part, because if they're not sitting in the ear correctly, you're not going to get your maximum amount of attenuation. So with the hand-formed plugs, you want to roll them between your thumb and finger to get them into a proper shape. Reach across the head to pull back and up on the ear. What that does is it straightens out the ear canal, which then allows you to insert the hand-formed earplug into the ear as deep as possible to be able to get the maximum amount of attenuation. Preformed, very similar, reaching back and pulling the ear back and up. which then straightens out the ear canal, which then allows you to sort of place it into the ear more deeply to get a better seal. If a good seal is not obtained, you may want to change the size to see if you get a better size with those. Earmuffs, you just want to make sure that the seal is not broken or cracked. And again, place the earmuffs directly over the ears and make sure the proper tension is there. And as I mentioned, glasses may impact the attenuation that's available. And then with the ear canal caps, as I mentioned, the blue tension piece can break down over time. But with these, you want to make sure they're clean, as with all of them, to provide the most amount of attenuation with the devices. And then with the custom earplugs, because it's made to your ear, it's relatively easy to insert and make sure that it's a good fit, but some people can still insert them a bit too shallow. So your audiologist will train you how to put in the custom earplugs with the maximum, with the proper placement. A couple of tests or tests that you can do when you're using these is listen to your own voice. Typically, if you're using the hand-formed plugs, when you have them inserted, your own voice is going to sound a lot more bassy or boomy. So when you have them inserted, your voice should sound boomy. In addition, when you're talking, it should sound like your voice is coming from the middle of your head versus one side versus the other side, which means that you have the ears in, you have the noise protection in each ear about the same. And then a good tug test. So when you pull on the earpiece, there should be some resistance. If not, it's not in the ear correctly. Or you can do a slight push on the earplug. And I say slight push, and you may be able to feel a little bit of a pumping action in the eardrum, where the eardrum move back and forth. And then the most important thing is listen to your ears. And so listen, let's say, to a water faucet running without the noise protection in, then put the noise protection in, and you should notice a decrease in the intensity. But remember to remove hearing protection carefully, check for cracks and hardening of material, and then practice insertion and pay attention to your ears. And with that, I'll stop the presentation and take your questions.
Thank you, Jack, for all that great information. So we have a number of questions. So just keep that in mind as you as you answer.
Of course.
And you're still sharing your screen here, so you might stop that and one of your active screens. So
oh yes, thank you.
Yeah. And there's a few questions about noise, and then quite a few questions about hearing tests. And so I'm going to start with the noise ones, and then I'll put the other ones to you first, or from there. So one question is about modern restaurants and how noisy they are, and conversations sometimes being impossible. This person's worried about servers in restaurants, and wondered if anyone's looked at that.
With regard to the noise level in restaurants for servers, I mean, there is concern when we think about nightclubs, the impact of noise exposure on bartenders, for example. And I definitely think there should be a consideration for servers in those loud environments. You know, in most cases, those servers aren't in those environments for 8 hours. The shifts are relatively short. Doesn't mean it shouldn't be something that's discussed. And I completely agree. Restaurants are very loud. I used to have an architect that was a patient. I asked him why restaurants were so loud, or as loud as they were. And he said it's basically for a variety of reasons. One, when you walk into the door, they want the restaurant to sound louder than it actually is. So you think it's more popular and you want to eat there. Number two, if the restaurant's very loud, then noise is now used as a barrier between the tables versus actually having a physical barrier to protect from conversation. Number three, they don't want you to stick around. They want you to eat your food. And if you can't have a conversation, then you're going to leave much sooner, and they can turn the table over much faster.
Oh, wow. I thought they were just neglecting instead of all that, intentional work. So someone is asking about the fact that they're going to attend many music festivals this summer, and that they are musicians themselves, and wondering about the hearing protection that you would recommend for that kind of an activity. Someone else was asking about an electric guitar and jamming with a small group. So musicians who might be around noise regularly.
Yeah, depending on the situation that you're in, if you're using electric guitar and you're having an amp or a monitor, in-the-ear monitors are a good option because then the monitor around you doesn't have to be as loud. That's playing the sound directly, at you. As I mentioned, there's some noise protection available, such as musicians' earplugs, that actually has musicians earplugs that can reduce the overall amplitude of the sound but still maintain the overall quality of the sound. So musicians earplugs are great, whether it's the preformed or the custom one, to give you the use that you can do over time, but yet again maintain the overall quality of the music without impacting. Yeah, it allows you to get the quality while being able to provide you with the reduction in the sound.
Thank you. There's a couple of questions about tinnitus, and is there any way to minimize it or prevent progression of it? And are there medications, perhaps cancer medications, that might contribute to it?
There can be some cancer medications that can contribute to it. I would talk to your physician about that. Obviously, if you know what cancer medication you're on, you can look that up online to look at some of the side effects. But there are some cancer medications that are toxic to the ear or ototoxic, that may actually cause tinnitus. Unfortunately, we're not. There's no silver bullet for tinnitus, but there are a lot of different options out there for individuals to try to alleviate the tinnitus or reduce the perception of tinnitus. Cognitive behavioral therapy, sound enrichment, or being around noises in the environment, which can distract from the tinnitus. If you have a hearing loss, some studies have shown that hearing aids can actually help reduce the perception of tinnitus because now it's amplifying the overall sound in the environment. And also your stress is reduced because you're not having to strain or focus to be able to understand people around you. But I was talking to uh, um, Sarah and James, thinking that tinnitus may be a good topic for next year to do, to kind of be able to focus specifically on tinnitus, be able to address any concerns that people may have. And
Yes,
obviously, you can reach out, and we can talk about that, or talk to your audiologist about that.
thanks, Jack. So now a few questions about hearing test results or hearing tests themselves. So in this case, they found that their hearing loss is right on the border of having hearing loss or not, and wondering how often they should be tested in that case.
Uh, Typically, we recommend anybody over the age of 55. It's a good idea to have your hearing evaluated on an annual or biannual basis, just to sort of monitor it. Obviously, if you notice any sudden change in your hearing sensitivity, it's a good idea to get it seen right away, because there are some medical conditions that can cause the hearing to drop dramatically, and time is of the essence in order to be able to get those be able to get that remediated. But I would say probably on an annual basis, if you can get an annual hearing test, that would be ideal.
This individual had, for various reasons, two hearing tests 3 weeks apart at different clinics, and there was a difference in their results, with one finding more difficulty than the other, and wondered if there's something to learn from that, or how common that might be, or what action that person might take.
Our instruments are calibrated, so calibrated so that theoretically, if you go from one clinic to another clinic, ideally your threshold should be the same. So I'm not exactly sure why you're seeing some variability for that, but if you are concerned, I would say getting a third opinion, I guess in this case, may be an option. But again, theoretically, there shouldn't be much variability. But it sounds like this may be something to kind of discuss with one of your audiologists, or maybe have somebody, the most recent person you saw, have them reevaluate your hearing potentially, just so you feel confident that it's repeatable.
Yes. Are there any hearing tests that a person can do online or at home that you would?
So our equipment is calibrated so that we can then compare the thresholds with normal hearing individuals. Online, there's not really, at this stage, there's no real calibrated system to be able to have some be considered what's called an audiogram, although there are tools online that people can use to determine how they may perform in certain environments, but it's not necessarily like an audiogram where you could get your hearing test and say, oh, well, you have what's called a mild hearing loss or a moderate hearing loss or normal hearing. It may just be you may be hearing or not hearing certain sounds more precisely. But hopefully we'll get there someday.
This person asks if having hearing aids will stop progressive hearing loss. Is that true? And how would that be true?
Uh, that's a good question, and it's a question I get quite often. So as we age, our hearing tends to decrease. Hearing aids typically will not slow this age-related progression, but there are some studies that show that if you have a hearing loss and you have deprivation or you're not getting stimulation to the brain, or your auditory pathway is not getting stimulation because sounds aren't getting heard at a certain level, that you can actually have a reduction in what's called speech understanding or your ability to understand complex signals. So your hearing thresholds, as I talked about the different pitches, we may not see an acceleration in their hearing that way if you're not wearing hearing aids, but what we could see potentially is a reduction in your ability to discriminate different speech sounds, more complex signals.
Great. I've got two more questions I'm going to put to you, Jack, and then we'll wind up. One person asked if age-related changes to the pinna, the outer ear, can impact hearing.
So it's right now the answer is no. Obviously, as we get older, there can be changes to the rigidity of the cartilage, but this does not cause an impact in the hearing sensitivity.
Okay.
That's a good question.
And just coming back to tinnitus, I think you're right. There are lots of interest in that. Just maybe you can just briefly address these. One is how does it happen? And another is it stress related?
So the perception of I'll address the second one first and the first one second. So the loudness perception of tinnitus may be stress related in that you may have tinnitus, but when you become more stressed, the tinnitus may be perceived louder to you relative in situations when you're less stressed. And so just there are some studies out there that show that mindfulness-based meditation, which obviously is a relaxation exercise, can reduce the perception of tinnitus. Again, nothing will get rid of the perception of tinnitus, but the important thing here is that we try to make it as less perceptible as possible, so you're able to push it into the back of your mind. The other question was, what causes tinnitus? We don't know exactly where tinnitus is caused. Right now, we know that tinnitus typically occurs when there's an infarct to the auditory system. So, for example, if you have noise exposure, if you're exposed to ototoxic medication, if you have age-related hearing loss, what occurs is that those hair cells, those fibers, are damaged. And so the damage of those fibers can cause tinnitus to occur. But what we have seen through some studies is it changes from being a peripheral phenomenon to a central phenomenon, in that now at some point, the tinnitus becomes permanent because this results in changes in the auditory pathway. And there's some anecdotal evidence for some individuals where the tinnitus was so bad that the recourse that they went for was actually have the auditory nerve, the nerve that connects the ear to the brain, severed. They would rather be completely deaf than hear their tinnitus. But when that nerve was severed, the patient still heard their tinnitus. Yeah. So it wasn't that the ear was causing the tinnitus, that's where it started, but now the tinnitus was actually part of the changes in the brain.
Wow. Well, lots of interesting questions on that one. For that question, tinnitus, Jack, is that a specialty within audiologists? Should people, seek the audiologist of their choice, or should they be looking for an audiologist with specialty in that area?
So we are trained in tinnitus. That is one of our areas that we do. Some audiologists do seek additional training or certification. I shouldn't say certification, additional training in tinnitus, um, just to kind of get as much information as possible. So, for example, through the American Board of Audiology, I hold a certificate in tinnitus management, which just means that I did additional training outside of my postgraduate work or with outside my postgraduate work to be able to learn more about tinnitus and the different aspects of tinnitus and the different types of remediation out there to be able to resolve or hopefully improve someone's tinnitus. So you're not able to go to CastlePo, which is our regulating body, to see which audiologists specialize in tinnitus. What you could always do if you're interested in learning more, or is if you're interested in finding an audiologist specializes in, I would just talk to the audiologist. So if you find somebody in your area, reach out to them, ask them, how much experience they've had working with tinnitus patients, and if they feel comfortable taking you on as a tinnitus patient.
Thank you, Jack. There are a number of comments about how fascinating the information was and thanking you for a great presentation.